Here now with more is Brandon Daniels from Exiger. He's president of global markets there. We've had you on a number of times, Brandon, to talk kind of about the logistics of getting these vaccines from one place to another. I guess on Moderna, one of the things that seems to stand out to people is, yeah, it has to be cold, but not as cold as Pfizer. So maybe it gets to some of these places that might not have had access or been able to store the Pfizer vaccine. Is that part of it for Moderna, and what else are you looking at?
Yes. This is what we had discussed a couple of conversations ago, Connell, where there are different advantages to each of the vaccine types, right? And there are going to be logistical challenges and benefits to each of the vaccines, from a outreach perspective to a hard-to-reach jurisdiction perspective. And so Moderna gives us an opportunity to start a broader scale of distribution to nursing homes, to pharmacies, to places that today don't have access to the vaccine because it has to be stored in industrial refrigerators, right? And that's going to make a huge difference for a large part of the population as these vaccines start to roll out. Now, still, at this point in time, Connell, we're essentially seeing fill to finish vaccines rolling off the line and going for immediate distribution to hub hospitals in each of the states. But again, as that starts to expand, Moderna creates a new logistical opportunity for us to reach underserved communities and non-local hospital communities.
Which is so important. We have some time before we're going to get to the point, obviously, where all of us have access to getting one of these vaccines or one of the other ones that might come online. I was talking to Mark McClellan, Dr. McClellan, earlier on this hour, as a former commissioner at the FDA, and he wrote this op-ed in the Wall Street Journal this week with Scott Gottlieb, and they were talking about the treatments that are supposed to get us from where we are now until the vaccine, when it's out completely. And the big problem, they say, with some of these antibody treatments especially, is they're just sitting on the shelves and people don't have access to them. I want to play a little bit of what he said about those treatments, and then maybe we can talk about how this issue might be solved. Here's Dr. McClellan from earlier this hour.
Probably are close to 1 million doses of these man-made antibodies. It's the same kind of antibodies that you make when you get a vaccine that gives you immunity, that neutralizes the virus. It does look like it substantially reduces risks of emergency room visits or hospitalizations. The problem is that in order to use it, we have to let people know quickly after they've been diagnosed that they need to get treatment, and then we need to set up a place for them to get it.
And that last part, Brandon, is what's not happening. And like a lot of these treatments, which are so promising, we all heard about it when the president had COVID, of course, is that they're just sitting there. And any suggestions on what we could do there to kind of speed along that process? Because it seems to me that would be important, because, you know, a lot of us, again, won't have access to the vaccine right away.
Well, at the very beginning of the COVID-19 response efforts, and specifically the Joint Acquisition Task Force, one of the things that we were looking closely at were treatments and alternatives to vaccines. And a lot of those treatments came online well before the promise of a vaccine had congealed, Connell. And so there are a lot of opportunities to start to treat COVID-19 patients in a more aggressive fashion. For instance, there are a number of drugs and treatments that have been approved to be formed into cocktails with remdesivir and have shown material improvements in COVID-19 recovery. We also have things like dexamethasone, other anti-inflammatory drugs that basically create an opportunity to fight the symptoms, to fight the inflammation, to fight the disease early on. But we've had a gap in clinician guidance, I feel like. And also, we've put so much towards the very end of the patient life cycle, right, when you're in the most severe condition, that we've kind of ignored this gap in between asymptomatic and severe, right? And I think that's where treatments could be a huge help, and we're missing a trick.
Yeah, we might not have a chance to solve it given the timing. I hope we do, but yeah, it seems to me to be really important. Brandon, always good to have you on with your analysis. Brandon Daniels, thank you, sir.